I have worked at Hartwell Veterans Medical Center for 2 years, long enough to know who matters and who the building has already decided doesn't. I am a social worker, not a clinician. I carry a clipboard and a caseload, and I spend most of my days in the corridor, between the second-floor inpatient ward and the elevator bank, shuttling paperwork and trying to find housing for men who deserve better than what the system usually offers them. I know the nurses by face and habit. I know which ones the attendings listen to and which ones they talk over. I thought I understood the hierarchy of this place. I did not understand anything until the Tuesday morning 5 men walked through the front doors at 7:30 and asked the security desk where they could find a nurse named Danny Greer. The week it happened, we had a new program director. Her name was Sutton. She came from a hospital consulting firm in Atlanta, and she had opinions about efficiency that she was not shy about sharing. On Monday morning, she called a department-wide meeting in the second-floor conference room and introduced what she called a competency-aligned task, structuring. What it meant, translated out of the language she used, was that nurses would be sorted by patient complexity. The high-acuity cases, post-surgical, acute neurological, the men just back from the polytrauma unit, would go to the senior staff. Chronic care ward, the long-term patients, the ones Sutton called stable maintenance cases, go to whoever she felt was least essential to the acute side. She looked around the room when she said it. Her eyes landed on Danny Greer, who was standing near the window with her arms at her sides. Watching Sutton the way you watch weather, you have already decided you cannot stop. Chronic ward suits your current skill level, Sutton said. Not a question, not a conversation. A verdict issued in front of 16 people, and then she moved on to the next agenda item as if she had said nothing worth remembering. I remember looking at Danny Greer's face when it happened. No color rose to her cheeks. Her jaw did not tighten. She looked at Sutton for one long moment, then looked down at her badge on its lanyard, then back up at the room, and she nodded once and walked out. 12 of the 16 people in that room looked away. I was one of them. I am not proud of that. She worked the chronic ward, all day Monday and all day Tuesday morning. I saw her twice in the corridor, once wheeling a medication cart past the lounge, once sitting with an old Marine named Elroy, who had been at Hartwell for 11 months, and who had not spoken more than 4 words to any staff member in all that time. She was not talking at him. She was sitting beside him with her hand near his on the armrest, not touching, just near, and they were both looking out the window at the parking lot, I thought. She is good at this. Then I thought nothing more of it, and went back to my caseload. The 5 men arrived at 7:32 on Tuesday morning. I know the time because I was at the security desk signing in a family member when they walked through the sliding doors in a line. Civilian clothes, jeans, work jackets, one in a flannel shirt with the sleeves rolled up despite the cold. They were not young. The oldest looked close to 50, with a close-cropped gray beard, and the kind of posture that does not come from good habits. It comes from years of someone requiring it. They were quiet. They did not announce themselves or raise their voices. The man at the front, the one with the beard, simply set his hands on the security counter and said, "We are looking for a nurse named Danny Greer, told she works on the second floor." The guard made a call. I stood where I was. I rode the elevator up with them. Nobody spoke. The man in the flannel shirt was cradling his right hand with his left. I noticed a faint tremor in the fingers, old nerve damage, the kind of thing you see in men who have been in situations that left marks that don't show on the outside. When the doors opened on 2, they followed me out without being asked, as if they already knew where they were going. Maybe they did. Maybe they had looked up the floor plan. Maybe men like these always know where they are going before they arrive. Danny Greer was at the end of the corridor, outside room 14, reviewing a chart. She had her back to the elevator. When she heard footsteps, she turned, and I watched her face in the moment she saw them, the first fraction of a second before anything organized itself. And what I saw there was not surprise. It was something older than surprise. Something that looked like recognition colliding with relief, or relief colliding with a grief she had been carrying so long she had stopped knowing its name. The man with the gray beard stopped 6 feet from her. The 4 men behind him stopped too, in a loose line, shoulder to shoulder. the way men stand when they have stood in lines before, and the standing meant something. He reached into his jacket pocket and produced a wallet. He opened it, and from behind his driver's license, he pulled a laminated photograph, small, the size of a playing card, and he held it out to her. She took it with both hands. I was close enough to see it, 7 men in desert kit, squinting into hard light, call signs written on the back in grease pencil. She looked at it for a long time. Then she looked up at him. "Cartridge," he said. She closed her eyes for 1 second. That was all. Then he came to attention. Not a parade ground snap, something quieter and more absolute. The kind of attention that costs something to render, given by men who know what it means. The 4 behind him came to attention in the same moment, as if they had rehearsed it, though I knew they had not. You do not rehearse that. You either have it or you do not. I would learn what I did not know standing in that corridor. Her name was Dani Greer, 31 years old. She had served 2 deployments as the medical sergeant attached to an operational detachment in Zabul province, Afghanistan, a job that, by regulation, does not exist for women, and yet somehow her record reflects she held it, and held it under a designation I will not pretend I fully understand. On her second deployment, ODA was cut off for 72 hours in a position with no resupply and no medevac and no outside support of any kind. Team's communications were destroyed in the first hour. She kept 7 men functional through 72 hours of isolation, 2 of them with injuries severe enough that in any other circumstance they would not have survived the wait. She improvised from a medical kit and whatever the terrain offered and whatever she remembered from a training program that is not publicly discussed. All 7 came home. The citation that followed was classified. The Bronze Star with Comtat fee that went into a box in her apartment was not something she mentioned to anyone. She left the army at 27 and became a nurse, and she took a position on the chronic care ward of a VA medical center in a mid-sized city, and she cared for old men who had been waiting years for someone to sit with them, and she did it without telling anyone who she was. Sutton appeared at the end of the corridor at 7:51. I do not know what brought her there. A staff call, a routine check, chance. She stopped when she saw the 5 men standing at attention in the corridor and did not move for a long moment. I watched her face work through something it clearly had no framework for. Dani Greer looked at the man with the gray beard and said quietly, "How did you find me?" "Elroy," he said. He made 1 call. She looked past them down the corridor toward room 14. Through the window, I could see Elroy in his chair by the window, watching the parking lot. The same as always. Except that his right hand was raised, just slightly, in the direction of the hallway. A salute so small it was almost private. For her, not for anyone else. Dani Greer pressed her lips together and looked at the ceiling for 1 moment. Then back at the 5 men still at attention in the corridor of the chronic ward. "At ease," she said. They relaxed, but they did not leave. The man in the flannel shirt, the one with the tremor in his hand, who had been closest to dying in that Zabul province hillside, stepped forward, something in her hand. I could not see what it was. She looked at it, then closed her fingers around it, and she nodded once. The same nod she had given the conference room the morning before. Except this one meant something entirely different. Sutton was still standing at the end of the corridor. She had not moved. When Dani Greer finally turned and saw her there, she did not say anything. She did not need to. The 5 men were still in the corridor, and they were looking at Sutton with the particular patience of people who have waited longer than 72 hours for more difficult things than this. And Sutton understood, without anyone speaking, exactly what she had said in that conference room, and exactly what it was worth. I have thought about that morning many times since. I think about the laminated photograph with the call signs in grease pencil, carried in a wallet behind a driver's license for however many years it had been there. I think about Elroy in room 14, who had not said more than 4 words to any staff member in 11 months, making 1 phone call in the night for the woman who had sat beside him with her hand near his on the armrest, not asking anything of him, just near. She came back to work the next morning. Chronic ward. Room 14, the same corridor. Nobody reassigned her. Nobody from administration said a word to her directly. Sutton, I was told, took an unscheduled personal day, I sign in at the security desk every morning now, and I ride the elevator to 2 and I walk the corridor and I nod to Danny Greer when I pass her, and she nods back, and neither of us mentions it. But I know what I saw. 5 men drove through the night from Fort Bragg, and they stood at attention in the corridor of the chronic care ward. And that is a thing I will not forget as long as I work in this building.